Welcome back again. This is your friend, not solution. This is a page you can get your health tips. So let's talk about premarital health check. This helps to prepare the to-be wed couples with both medical and educational components on one's general and reproductive health. This package is designed to detect some of the most common health problems, hereditary disorders, and certain infections such as HIV, hepatitis, etc., which may have a bearing on the fertility of the partner and or child's health in the transmission of sexually transmitted diseases or infections. Recommended for the couple contemplating marriage who would like to know partner's health status and their compatibility from scientific point of view. You understand? You have the moral, you have so to look for certain hereditary disorders where both the partners may have the same problem, but are only carriers of the disease and are asymptomatic. But by coming together, their offspring might have probability of developing the disease and the symptoms. So premarital health check is very, very important because it helps to prepare you. You are handy. You understand? You know what you are going into. Not that you are just gambling. Not that you are just gambling. It is very, very necessary because at times also you see people marrying. You see AS marrying AS. And what happens at the end of the day is that they give birth to children that HBSS. And when they have HBSS, most of the time the crisis is not palatable. It will have impact on the family and a whole lot of things. You understand? The finances, the emotional, the psychological, fasting is not needed. And all these some of the things recommended, some of the various things recommended for couples contemplating marriage who would like to know your partner's health, or it's just to prevent. You understand? It's just to prevent some problems that it is easy for you to, if you still want to go into it. That's your choice. But when you don't know, it is not easy when it happens. So it's recommended for age 18 and above. The frequency, some of the tests we have, hemogram, that's about your blood, hemoglobin, your pack cell volume. We want to know your red blood cell count, your white blood cell count, differential count, platelet count. You understand? The ESR, peripheral smear, a lot of things. When you get there, your blood sugar, we want to do your random blood sugar, your fasting blood sugar, your HbA1c, general test for venereal diseases, HIV test, hepatitis test, blood grouping, and resource typing. That's your your genotype. Also ultrasonography for pelvics for women, so that they will know if your pelvis is roomy to be able to have the baby. Consultation, clinical examination. They can do semen analysis and consultation. You understand? They want to know if your sperm will be able to produce. It is very, very necessary for men. You understand? And of course, in totality, you can have the overall medical summary before you go into that relationship. See you in the next